that afterwards so people can see it. And another thing that maybe you guys might like to know is that we initially planned this for 2 hours. That's what it said on the website when you registered. But really, we're planning for this just to be 1 hour. So you hopefully will get another hour back in your day. And usually people don't complain about that. And our discussion, if it's rich and exciting, we can continue it. We don't have to cut it off. But if folks are anxious to get going, then we'll try to stick to just the 1 hour. And with that, I think we'll go and get started. How about the next slide? Great, that's working. Everything's working. So this is our agenda for today. I'll go through some welcoming slides about Evermore and then about our Lived Experience Bereavement Research Network, or LEBRN project. And then Lisa Stewart will talk about how we develop engagement principles, and particularly for research partnerships. And then I will talk, kind of present our emerging engagement principles, what we've really been working on heavily the last few months. And then we'll open it up for some question and answer and discussion. And we'll go from there. The next slide, please. So just about Evermore, I imagine if you found this webinar, you've already know quite a bit about Evermore and are familiar with Evermore. But just to say that Evermore is broader than just this project that we're talking about today, but Evermore works with communities, with decision makers, with care providers to advocate for better systems of bereavement care. We also do other science work as well. So there's a science newsletter that comes out, and data reports. And one of the data reports from a couple of years ago, like the Orphans Report, has been really valuable. Next slide, please. And just to review Evermore's mission and vision. So Evermore is dedicated to making the world a more livable place for all bereaved people. We envision a world where all bereaved people achieve healthy and prosperous futures. And our value proposition is where this really hits the road, accelerating lasting social change using data and science to drive policy and practice change for all bereaved people in America. And then we have a set of values that that actually have been really helpful to inform everything that we're doing in this project as well. So creating just systems for all, and recognizing our differences and being respectful. Relying on the highest quality evidence in our decision making, driving innovation in bereavement care, and being committed to being trustworthy, to being a trusted community partner and leader. Next slide. So similar to our values, our guiding principles are very important to us. Evermore uses these across all their projects and teams. And these include maintaining confidentiality when we're working with communities, making room for everyone to contribute to the discussion, speaking your truth, and listening with curiosity. Next slide. Recognizing that together we know a lot, and courage and honesty, assuming the best in one another, and intent and impact. These are the guiding principles that Evermore uses, and they really also have been very helpful as we go through the process of developing our engagement principles. Next slide. So I'd like to talk a little bit about the Lived Experience Bereavement Research Network, kind of an overview of the project and where we've been and where we're going. Next slide. So the goal of what we call LEBRN is to gather a diverse network of people, including those with lived experience of bereavement, researchers, and care providers, to inform the future of research by and for bereaved people. Next slide. And I'll just say, by joining the webinar series, we do consider people here attending this webinar as part of this network, kind of this ever-expanding research network. So we really value your participation, your feedback. It's really valuable to the overall project. This is our team. Joyelle Mulheron, Evermore's founder and executive director, who many of you probably know, unfortunately can't be here today. So she's entrusted us to carry the mantle, and we're doing our best. I'm Tom Weiser. I'm a medical epidemiologist, and I serve as the director of health initiatives. And we have two project consultants, Ellen Schultz, who's in the background today running everything. And we really appreciate that she's doing that because
froze for me. Anybody else having that problem? Yeah, okay. Lisa, do you want to pick it up here? And when his internet catches up, he can pass the baton. He can take it back from you.
Sure. And I think that cues me up to introduce myself. I'm Lisa Stewart, one of the four legs of the project team. You can go ahead.
Sure. And I'm Ellen Schultz. As Tom said, I'm a consultant helping with this project in a variety of capacities. And today I'm going to be our tech support. So if there are issues, you can put a message in the chat and I'll be jumping in and out. I'll be helping during the discussion leader so everyone can come off of mute. All right. It looks like Tom dropped off. Probably he has to rejoin, Lisa. So why don't you take the baton from here, and then I'm going to keep an eye out for when he rejoins and remakes.
Sounds good. Let's go to the next slide. All right. So we all here together are part of the LEBRN network. However, there's been a core group of advisors that have been working with us and collaborating with us over the past few months. And I won't go through everyone's name here, but we did segment them by like the perspectives that they're foregrounding and their participation. And the three subgroups, as you see, are our lived experience advisors, our care provider advisors, as well as our research advisors. Next. You can go forward, Ellen. Thank you.
all right, I'm back.
Oh, great. Oh, great. You can take it from here. I didn't say anything pertaining to this slide yet, Tom.
Yeah, it just froze up and died and took forever to restart. Sorry about that. So our lived experience bereavement research network, we've talked about these before, the three goals, but it's funded by PCORI, which is the Patient-Centered Outcomes Research Institute, under the Eugene Washington Engagement Award. And so this network, this webinar, and every one in our advisory committee as part of this network is our first goal. And then developing the engagement principles for bereavement research is our second goal. And our third is to develop a high priority bereavement research agenda. So that's where those are the three things that we are set to do, and hopefully we will be doing. Next slide. So this is just our timeline, and it shows kind of where we are, the green box, with our second webinar. And you can see we're getting close to the end of our first year. And we've had 3 advisory committee meetings so far, and we have another one coming up in November. And then most of this time we've been working on engagement principles. And in the second half of our project, we'll be turning our focus onto more of the research questions. We'll probably still come back to talk a little bit about engagement principles and see how those are helping us in developing the questions. Next slide. So we thought it might be good to let people know in our first webinar, kind of a reminder of what we talked about. So we had 2 guest presenters on that webinar. Sangeeta Ahluwalia, who is a senior policy researcher at RAND Healthcare. She presented on the Agency for Healthcare Research Quality systematic review on the evidence of bereavement interventions. And I think we're going to put a link to that recording and also to the document in the chat. but she really talked about this study in great detail. They looked at over 200 published papers that met the quality requirements. And they found that the majority of the studies that were published were focused on interventions. And there was some moderate strength evidence was found for psychotherapy and expert-led support groups in this review. But they didn't find good quality evidence to support peer support or spiritual counseling or creative art therapies or other types of interventions. And then regarding screening, they looked to see if there was any evidence to support universal screening for bereavement, and they did not find a good quality evidence that would support that. They did find reasonable evidence to support certain tools that could be used to help screen for being at risk for complicated grief. And she concluded that more research was really needed to identify effective screening and treatment approaches, and that the more emphasis needed to be placed on documenting adverse treatment outcomes and standardization of both diagnoses and outcomes. Our second presenter on that webinar was Michelle Johnson Fleece. She's an associate director at PCORI, and she did a review of a lot of the stuff that PCORI does, and focusing a lot on patient-centered clinical comparative effectiveness research, or CER. She did talk a lot about also engagement in research and how they define that at PCORI, which is active participation between researchers, patients, caregivers, clinicians, and others throughout the research process, from planning and conducting the study to disseminating the study results. So that was really helpful. So we have a better understanding of what engagement even means. And then she also talked about how engagement can occur at any stage with different people, and it really shapes how the research is planned and carried out. So we'll talk a lot more about engagement in our next few slides. So next slide. So after that webinar, we sent out a survey to the participants. We had about 60 people who actually attended the webinar, and we got about 20 responses to the survey. And we asked them the question, one thing I think researchers should know or understand about working with bereaved people is, and we heard a lot that really resonated with our own personal experience, those of us on the team, and also with what we heard from our advisory committee members as well. So we heard such things as, grief is unique, that every person experiences grief differently, that the context is really important, that grief is ongoing and non-linear, it's never finished, and that bereaved people need support and need to be listened to and have their experiences valued and respected. And these show up for us in what we're putting together in engagement principles. Next slide. We also asked about challenges, an important challenge for bereaved people who want to get involved with bereavement research. And some of the things that they told us there also kind of help inform some of the underlying values of engagement. Things such as patience, respect, and trust that are needed to kind of overcome these obstacles or these challenges. Next slide. So at this point, I'd like to introduce Lisa Stewart to talk about how we developed engagement principles, or how we are developing them. Lisa has years of experience with engagement, first as a patient navigator and community co-investigator on patient-centered research studies. She's also previously worked at PCORI, focusing on community and patient engagement. And for more than a decade, she's been advancing community and patient engagement in health research through technical assistance, resource development, and collection and analysis of community input for public and private research organizations. So we're really lucky to have Lisa on our team, and I'll turn it over to you.
Tom, I may be a bit duplicative in some of my statements that you just said, Tom, but just to bring some emphasis to them. For PCORI, as Tom mentioned, PCORI funds research, and that centers what matters most to the people affected by a condition or circumstance to ensure their values and preferences are represented throughout the research process. And to achieve that, true partnerships between researchers and people with lived experience is needed, as well as representatives of organizations and providers and all the list of different voices that Tom mapped out in his initial comments. In practice, that means people with lived experience are involved in decision making and serving in meaningful advisory and leadership roles from the very beginning. Engagement principles represent a set of shared values that guide how researchers and non researchers work together to bridge their different beliefs and experiences and perspectives. They provide an anchor and reminder of how to show up for one another. Engagement principles are especially important for bereavement research because the stakes are deeply personal. Engagement must be grounded in compassion and dignity as well as respect because many grief experiences are invisible, which means they can be easily minimized or misinterpreted. And because, and this really builds off the last webinar, what we heard about the AHRQ report findings, because there's a tremendous opportunity here to better support the well-being of bereaved people through practice and policy change. Next slide. So I'm going to discuss our journey to date. There we go. I hope you can see it well. But this maps out where we've been in this process so far. So Evermore embarked on a journey that began with preliminary information gathering. In April, the team convened separately the 3 subgroups that were identified at the beginning: the lived experience advisors, the care provider advisors, and the research advisors. We met separately to allow us to share information that was really catered to each of those subgroups and their experience or relationship to research, and allow us to hear about their experiences, again, in a very informal way as a method of onboarding to the project. We then well, I can say based on information that was gathered, as well as pre and post surveys, we extracted key ideas about challenges and facilitators for developing strong partnerships. During this phase, we also reviewed engagement principles developed by other organizations. These included principles developed by the CDC, the Association of American Medical Colleges, Center for Health Justice, Indigenous Serving Organizations, PCORI, among others. And when looking at them together, we saw a tremendous overlap. There were certain core values that just really popped up across everything we read, and that would be, and we saw on the previous slide, respect and transparency, as well as equity and inclusion. The next stage in this journey was to get a better understanding of the unique realities of bereavement and conducting bereavement research, including the challenges experienced by all different parties and the values that are important to uplift. In July, the first full advisory council meeting was held, during which the council broke into mixed breakout groups to discuss these issues. Then, following that meeting, in August, the project team met with representatives of the 3 subgroups to further explore and really dig deeper into some of the issues that we heard during the full group meeting. The team then synthesized what it heard into key themes and circulated those back to the council to gather their feedback. That launched us into the next and current stage, which is this iterative feedback process. In September, the full council met again to discuss major themes that were shared out after they were synthesized following the July and August meetings. And then from there, went on a journey of developing what we're calling emerging principles, and circulated that back out to the group, which brings us to today at this meeting where we look to you, the full network, for your additional feedback. Next slide. So over the course of this journey, we've heard a lot. We heard as top line, for example, that in order to build partnerships, there must be an intentional focus on building relationships with communities from the beginning. That the perspectives of non-researcher partners and researchers must be valued equally. That bereavement is a unique and individual experience, as we've said, that requires flexibility by researchers. That engagement is truly difficult and requires different skills that researchers and non-researchers may have exercised in their work to date. And that preparation is really essential, as well as representation. So when we looked across everything, all our notes, all the inputs that we received from the various channels, what kept rising to the surface for the project team was an overarching issue about trust and trustworthiness, and the tremendous opportunity that the principles provide for setting the stage for trust building. From the perspective of people with lived experience, trust in the past, from what we heard, has been impacted by a sense that communities have not always been listened to fully, and that researchers sometimes, based off their experiences, have come to communities with preset agendas, which have compromised trust. So the tendency has been to be somewhat hesitant or defensive or not fully open to research partnership opportunities because of some of these past experiences. Therefore, the project team thought it was critically important to develop principles that would truly center the voice of people with lived experience, writing them for researcher audience as if being spoken to by communities of non-researchers. And we thought this was important for several reasons, because it provided an opportunity to build a sense of safety and inclusion, to address power dynamics within mixed partnerships, and to really demonstrate that people with lived experience are being heard. And to that end, we also felt that it was critically important to be direct. A lot of the principles that we have found have used very general language that sometimes was not action oriented. Again, this is when we scanned the environment and looked at other principles that exist. We also recognize that to really be adopted and to put in practice, there probably needed to be tools and resources that encourage use, whether they be checklists or readiness and accountability kind of statements and actions that could be done to support their use. So I'm going to turn it back over to you, Tom, but that's a general overview of where we've been and what we've been doing.
Great, thanks so much, Lisa. So let's unpack what we've been working on. Next slide. So this slide talks about setting the stage, foundations for bereavement research. And we felt that there were three kind of overarching themes that needed to be addressed before research engagement can really take place. Some, though not all of our advisory council members, felt that the researchers choosing to engage in bereavement research using patient or community-centered approaches need to be reminded to really listen for understanding. And similar to what Lisa said, too often people's experience was that researchers may enter into the research with too narrow of a focus or with preconceived notions. And so if the research is really going to be reflective of the needs of the community, then the researchers must approach it with their minds as open as possible and with deep reflective listening. So listen is one of those overarching themes. The second is to acknowledge the potential for harm. Understand how poorly done research can and has caused harm to people experiencing bereavement. We know that research can cause community harms and may lead the community to no longer be willing to participate in research or to lose trust in research results that could actually, impart a benefit to the community. And then similarly, do better. A commitment to do better, to doing better research through better engagement is what's needed. So deepening understanding and building trust are vital to successful collaboration with people experiencing bereavement, and to making that commitment to do better. So those are the sort of the three things that we feel like really need to be in place, even before considering engagement. Next slide. So the emerging engagement principles that are coming out for us are coming from these conversations, and they may seem a bit provocative, especially to some researchers who are already doing this work and they're doing it in a good way, and they may feel like, well, why are you telling me this? So they might feel somewhat offended. But yet we heard quite a bit that there are negative research experiences that people have had, who, have been in this space, who are care providers or who are people who lived experience. And we see that this might be an opportunity for them to prevent those from happening again. So we'll go through these, and I have a few comments to make otherwise. So the first one is understand me. Seek to understand my experience, insights, and expertise, recognizing that grief is personal and unlimited. So this is one of these principles that is more specific to bereavement than the others. And it asks that researchers really learn about how bereaved people see themselves and how they describe their experience. With that level of understanding, then the researchers will be in a better place to develop meaningful patient-centered research. Respect me. Acknowledge and respect the unique experiences of bereaved individuals. So this one, similar to the first one, is also more specific to bereavement, but it takes it a step further, respecting the experiences of bereaved people when engaging with them to create research projects, because they may not have a research background, but their lived experience is vital and needs to be respected, and really on an equal level as the experienced researcher. Join me. Ask me what I want to know or gain from research and how it might benefit me or my community, and stay on the journey with me. So people with lived experience who are engaging with researchers really want to contribute. Their experiences is what should be driving the research agenda. Patient and community engagement in research also takes a long time and a lot of commitment. So it shouldn't be just one and done. Once the collaboration is formed, people who engage will expect it to continue. Be honest with me. Be authentic and upfront about your constraints and limitations. Demonstrate your trustworthiness. People appreciate honesty, and they want to know that they can count on you and they can trust you. Include me in decisions. Work with me to frame research questions, design, conduct, and share research. Include me in leadership roles. Ensure that people with lived experience are co-creating, co-leading the research at every step of the way and defining what matters most to them. So we're going to copy these into the chat for reference so that when we have our discussion, we can kind of look over at the chat. We'll move to the next slide. Nope, there we go. So here's the point that we really wanted to get to in this webinar, which is, have you guys had a chance to see what we just wrote about, and then tell us a little bit about what you think. What you think about how these land for you, and it's going to be hard to have any kind of back and forth discussion. So I'm going to ask Lisa to explain how we're going to do this. Not Lisa, Ellen.
Okay, so we've got a pretty good sized group here, which means currently you all are not able to take yourselves on and off of mute. I have the magic power to be able to do that. So the way this is going to go is Tom and Lisa will be sort of moderating the discussion. The best way to be able to, come into the conversation is to use the raise hand feature of Zoom. If you look at the bottom of your screen, sometimes you have to hover over it. A menu will pop up, and maybe about in the middle, you'll see sort of like a hand outline. And if you hit that, then it'll pop up a little hand in the corner of your window, and that will notify me that you want to be able to join in. If you can't figure that out, if you're on video, like give a wave, or you can also put something in the chat that will let us know. When Tom or Lisa, sort of calls on you, what I'm going to do is I will ask you to unmute, and then something's going to pop up in your screen that says the host is asking you to unmute. If you click, OK on that or unmute, you should be able to come off and make your comment. And then once you remute yourself, we have to go through that procedure again. If anyone's really having trouble with that, again, welcome you to put your comments in the chat, or you can send me, a message in the chat, and I'll help you work through that. But hopefully that helps so that we don't end up with too much background noise, but you all are able to join the conversation. So anyway, thank you for working through that with us. And so I'll hand it back, Tom and Lisa, to be able to open the floor.
All right, yeah, so I was trying to help Lisa by working on the chat there, but I wasn't able to access it. She's got them in the chat. So you can see what was on the previous slides, the last two slides. That way we can kind of refer to it, and we'll go from there. So, as we mentioned, these principles are really meant to drive cultural change and to improve the quality of research for bereavement. So we'd like to hear from folks if they've had a chance to read through these and digest them a little bit, if there's anything that they might do differently or think that is redundant or should be taken out, or anything that's missing that should be added. And we do have some of our advisory council members here. So I'd like to maybe see if they might want to, a few of them might want to make a few first comments that they've had a little more time to look at this and read it. And so I see Joanne is there. And Joanne, if you can get unmuted,
Sure.
then maybe you can just talk a little bit about your experience and how it's been and how this sits for you. Thanks.
Yeah, happy to. Thank you. Thanks for the invitation. Thank you for being here, everyone. I'm excited actually about these principles and this ever evolving philosophy, because of course we need to center the well-being of those with lived experiences. And so I'm really pleased with the outcome, with the report, not just professionally, but also personally as someone with lived experience. Here at Sella Care Farm, which we do conduct research, we have an advisory board that has been guiding us, and they're people with lived experience. But we have recently actually just created a document that reflects our values, our egalitarian values for our research team. And so they mirror many of the things. The only thing that that is a little bit different is that we ask for our team to consider prevision, which is the opportunity for those with lived experience to preview the manuscript before it's actually submitted for publication, for accuracy and for the tenor of the outcomes. And so I'm just really pleased. I'm happy to see everyone here. And I think from my experience, the real experts in this are the grieving people themselves, not the scholars. It is grieving people themselves who should have the right, in a Thomas Kuhnian sense. That's what Thomas Kuhn said in Structure of a Scientific Revolution. He said there is no more greater assent than the feedback of the relevant community. And so thank you, everyone. And thank you, LeBron, for doing what you do. I think it's very, very important.
Thanks so much. That's awesome. Also, I saw that Donna had joined, Donna Sherman from Portland. Are you able to unmute
I am.
and share a little bit about
Am I
your
unmuted?
experience? You are unmuted. We hear you.
Okay, great. I'm sorry to not be showing up physically, just not in a place to do that right now. But yeah, I think echoing Joanne's comments, it's been a great process to bring together people who have, and many of us have lived experience and research experience and community-based. So it's not like three pots of people in this work group who only bring one aspect to the table. And it's been interesting as we get into small groups and discuss things, how, at least for me, one or the other of those three, because I am a researcher, I am a clinician, I have lived experience, and which of those sort of starts taking priority based on what the discussion is. And so I think it really braids together these groups of great thinkers and people with such good intention and such good experience. And I also just really have valued the lived experience, having been part of an organization, Dougie Center in Portland, where we have had some not extremely successful liaisons with research teams, and also some excellent ones, both, that I think it's really important for us all in this field, as we hopefully do more and more research, to make sure that we are centering what are we doing, not just with the groups that we're interviewing, but what are we doing to them? And how are we involving them in the information that we gather from them? Because I've been involved in more than 4 research studies where the researchers went and they did, and the next thing I know, there's an article published. They never gave us any information. We heard nothing back from them, and our families who participated were asking, and we felt we felt not good about not being able to respond to them in better ways. And so that has informed what kind of research we will engage with. And I can tell you at Dougie Center, and this is not an exaggeration, we receive probably a half a dozen requests a month for teams to research, because we have 500 parents or adult caregivers, and almost 700 children. So it's a ripe lived experience group of people, but we also have to make sure that they're respected and that they are valued. So thank you all for being here. Thank you to my colleagues, Mary Frances, Wendy, Joanne, who've been part of this process together. And I think it'll be better because of all of us participating with the different lenses that we bring to it. So thank you.
Thanks, Donna. Really appreciate that. Ellen, are there any hands raised?
There are not, but again, I think the floor is open. We'd love to hear from more folks. So again, if you use the raise hand feature, that helps. If not, give me a wave. I see Jade, so let me get you unmuted. Yeah, let's see. There you go. You should be able to come off.
Hello. Hi, everyone. It's great to be here. I was looking at these. I think they're fantastic and thinking about respectfulness and seeking to understand. I feel like this is a step in a beautiful direction. I do wonder, there's something that struck me that I would have expected to see there, and that relates to viewing people within their context, right? Within their cultural context, their situational context. I've lived experience. I was widowed in my 30s. I lead bereavement groups for other widowed folks under the age of 50, and have done a number of other groups. And so much of the lived experience is colored by positionality, life circumstances, right? The ability that I had to lean into my grief as a young woman without kids is very different than my members who have 6 kids and 2 jobs, right? So that ability to really put them in their context so that we can see those layers of nuance, because I think that that's something that's really missing in a lot of the research.
Thank you.
Yeah.
That's a really good comment.
And we heard that quite a bit. And what I would say is that it's here, but it's here subtly. And part of what we're hearing is that it needs to be here more explicitly. So when we were thinking about understand me and respect me, that was definitely driven by what we were hearing about the importance of cultural context and understanding that we're bringing different ways of grieving, different understanding, different norms, cultural norms and practices that support or respond to grieving. So, and also what is being presented is very bare bones. We see this as being introduced with a longer statement, a preamble, if you will, that goes into some of those nuances that you're referring to. So it's there. We'll bring it out more. I think that's what we're hearing as a piece of advice.
Mhm.
And
Absolutely.
just to know, I reposted the setting the stage and the emerging principles. There was a little bit of a version control issue that I was trying to work out in the back end. So this is it's easier to see and more current.
All right, I see Sarah McCarthy, you have your hand up, so I'm going to go to you next.
Thank you. And Lisa, this might be covered a little bit in kind of the answer you gave to the last question. And I will say I'm coming at this as a clinician and a bereavement researcher, and then also a bereaved parent. So I'm wearing all three of those hats. But one of the things I think that I've been struck by and think a lot about is that in the current way that we set up research, it really, it often is the researchers coming in it not only with preconceived notions, but also kind of frameworks and ideas and thoughts, at least, especially from an intervention standpoint, about where this is going to go. And so I do wonder if with the joining me, there's a way to expand it to really recognize the amount of power there can be in idea generation from those with lived experience, not only around kind of research outcomes and research variables in those pieces, but kind of what might work. Because I think that it's one thing to draw from the research field about what interventions we know have the possibility of working and how things in other areas might be adapted, but it's another um, thing to think, like, really having people start at ground zero and say, what types of things would you want? And kind of that more generative way of approaching intervention development. Because I mean, I think the work Joanne's done is a beautiful example of that, right? When you totally step outside the box and think about what helped one person and how might that, be looked at in other people, I think there's so much opportunity for really groundbreaking and extraordinarily helpful things coming out of a network like this.
Yeah,
Yes,
I
I think
agree.
so.
And I think that there's we can't say enough the importance of involving different perspectives from the very beginning, so in that idea generation stage for sure.
Other hands?
Okay, I see Heidi. I'm gonna unmute you.
Hi, can you hear me?
You're good to
Yes.
go.
Great, thanks. So sorry, I'm not in a place to put the camera on either. But this is kind of related to the prior question from Sarah, and I will say I'm coming at this from a perspective of a person with lived experience, as well as an instructor in a community college where I have lots of students with lived experience. And I'm a health or medical anthropologist. And I was curious, looking at the framework, a lot of kind of even this idea of idea generation seems tied to something that's very much more common in my own field of anthropology than it once was. And that's the idea of co-production models, so that people who are members of the cultural community are involved at all stages from the very beginning and all the way through, including in publication and sharing research results. And there are elements of this description that seem to be similar, but that I wondered if that idea of co-production, rather than inclusion or consultation, but co-producing with lived communities, if that's something you considered, or if that's something that might make sense.
I think that's not something that we've considered, so it hasn't come up before. Lisa, do you have any thoughts on that?
A couple of thoughts. Um, Engagement is looked at across a spectrum. And then like on a low end of the spectrum, it may be input, right? Like it's input or, periodic or advising on a low level. On a more intense level, we find like co-production and community-led, right? Research and research ideas. Co-production from PCORI standpoint, this element of co-production is really the driver of this. So collaboration, co-production, community-led are on that higher level of intensity of engagement and like the ideal. It really moves from participatory research methods and coming from, I heard Thomas Kuhn come up once or twice in these conversations, but dealing with power, addressing power and power imbalances and shifting power and sharing power is very much integrated into the thinking.
Great, thanks. I think there's some really interesting models out there to look at from a lot of contexts outside of the bereavement research world that could be potential food for thought for this group as well. That's just what occurred to me.
Heidi, is there any language that you would recommend us considering as we flesh that out some more?
Well, I think even that idea of co-production, right, which is not, that's including or joining, right? It has a little bit of a different feel. There's collaboration maybe is different. Not everybody might have a context for understanding what that means, co-production. So the idea of the generative phase of idea generation, that's part of it. It's a great question. I would want to look at some of the models and see what examples they use, because it is very enculturated to local contexts in anthropology, certainly. But everybody from archaeologists to anthropologists working with contemporary living cultures of different kinds are, have maybe slightly different language. So I would be I'd be happy to look at what some of the, other than saying co-production, what are the other words that are, but it has a different tone than bringing people in versus collectively starting and generating something together. At least to me, it does. So I just wanted to share that idea that there's lots of interesting work, not just in my field, but elsewhere around these models. And this clearly overlaps with that idea as you just were describing, but might have some elements that you could expand on.
Yeah, thank you. We appreciate that distinction.
Sure, thank you.
I saw that Lori, you had your hand up a few minutes ago and it came down, but I wanted to create some space if there was a comment that you still wanted to bring in here.
Thank you for that. Can you hear me?
Yes, yeah, go
Okay.
ahead.
Thanks. So I'm a nurse and I work at a children's hospital. I'm also a PCORI member here in Canada, and I was part of the generation creation, all the pre-thinking, all the way through to the process of publication, and I am a published author on the paper on a diabetes eye study. It did not require a huge amount of work from me as a participant, but I was given the respect and valuing for my knowledge, my understanding. Maybe it was a benefit that I'm a nurse. Maybe it was a benefit that I've already done research in another area. But I think our bereaved parents, I know from my organization, want to be part of this. They want to engage. I joined this meeting to try and figure out a better process, because right now everybody in our hospital has to go through the family advisory committee to become a member, and then they have to do several steps before they're even considered to be able to be a research participant. That doesn't make sense to me, because not all of them want to engage in talking about the organization and things like that. But there are just, from a hospital perspective, from a province in Canada perspective, and across Canada and the US, I think there are so many things that we could do to compare and contrast, to understand better the specific needs of certain communities within our lands, that we need to take advantage of these people who want to help. They want to make a difference. And I'm loving some of the conversation happening, and I agree completely with the person who spoke before me about the need to engage early on. Thanks.
Awesome. Thank you so much. And it's a great testament to to the approach that you've been able to experience that as well. That's what we're trying to put together, what we're trying to accomplish.
I would say that really comes from the field up, like these forums. Generally, funders are not prescriptive on how engagement occurs or what it looks like. They may provide guidance, but they don't say it must meet these minimum standards yet. So.
Other thoughts? We probably have time for one or two other comments. All right, Mary Frances, I see your hand up. I'll go to you next.
Hi, everyone. I've been really enjoying this conversation and just the whole process. And I just thought I might reflect as a person who has been doing research for a long time and has engaged more and more in community participatory research across my career, not having been trained that way initially. And I've just been really reflecting in the past, well, since the advisory groups last met, as I'm writing papers, even, right? Even at that stage, just really had a lot of self-reflection on how much my language has changed over time. The words that I use to describe grief and grieving, the people who are grieving, mechanisms, all those things, and getting my co-authors, and as I review manuscripts, getting the people who are submitting manuscripts to really think about, you know, what does this feel like if it's being read by a bereaved person? And just that in and of itself, I mean, that's a very small of a lot of big changes that I've made, but just that alone has changed some of my language over time. And I'm very grateful to feel like I'm mapping the world maybe differently than I would have before really big integration opportunities like this were available. So grateful.
Oh, thanks, Mary. And we're glad to have you as part of our advisory council. It's been really a pleasure getting to know you and hear your thoughts. Always have so much to say from so much experience. Ellen, if we've got a minute, maybe we could ask Wendy to just comment a little bit about her experience being on the council as well.
I literally just put something in the chat with respect to this. I was just, oh, first of all, I mean, there's so much to piggyback off of, but I feel so similarly to what everything that's been said about what Mary Frances just said about language. Like I have, I can't say prolonged grief disorder anymore. Like I can't do it. So I'm presentations that are inconsistent with chronically severe, debilitating, I struggle so much because we want the parts that are helpful received, and I mean, I certainly understand where language hurts and can lead people to to feel like to not, because of their responses, natural responses, understandable responses, the science gets lost. So that's just a way of reiterating my language is changing, and that's why I'm so glad to be in this group to think about how do we phrase things, word things, when we all might be talking about the same thing, but we know that that how we frame it is everything. So yeah, the part that I just thank you, Joanne. I see that important wording. I mean, it's like enduring. Of course, it's enduring grief. It's always enduring grief. And then we're talking about like, when does that become disruptive? And anyway, this is what I hope to learn from this group, is finding the words, and then also understanding that not all words work for everybody, right? This is the other piece of it. And how do you do a good assessment to know how to then frame something so that the construct, the idea that we're getting at, can be understood and then evaluated. But what I just put in the chat was more on this idea of team science, which, you know, just thinking about, I was just looking through the National Academy's report on it, and some principles as the idea of co-production was coming up that Sarah raised, and that Heidi talked about, this idea of how do we, from the start, if there is idea generation, where is, how do we establish rules of play? And I'm doing a lot right now. We have a number of projects that I have collaborators, and everybody's been getting a vendor agreement. I don't know, from people who are consultants on studies, we always give vendor agreements. And I have 3 situations, I'll call them, where my collaborators, equal partners in this, who were thinking together, got a supplier vendor agreement to be onboarded through my university. The language there is that they're doing a service, and that they're not involved in the creation and science, and the implications there, which I didn't know these agreements, how they were worded when they were going out, because I'm at a new institution. It's offensive. And so these ideas, so this is a whole thing that we're trying to work out, of how to language the difference between a collaborative investigator, a partner in that way, and someone who is getting paid as a consultant. And it's so these ideas around language and their what their implications around starting from the start, an agreement of how this will be discussed, where there is, I'm going to put in quotes, ownership, because IP and all of that comes in when we talk about production, and ways that I think those in academia have been socialized to think about that. And it's very different what the metrics are that academics have that are playing into publication and things like that, that influence our choices in that whole reporting and getting it out there process. All of it is so important. So I think even just thinking about how, when you're coming together, you establish in that National Academies piece, like a charter from the start. Who are we? What are our roles? How do we, in this co-creation, own it together? And what does that mean? And what can we do with it? Because as Lori was just saying, like, it's all about helping ultimately, and it's meaningful, but there are these other metrics at play. So those were my thoughts listening to all of this really meaningful conversation. Thank you.
Thank you. So glad you could join, and it's been great having you as on our committee as well. Ellen, we're about out of time, official time that we planned for, but if there's any last hands raised, any other last questions or comments. There's some stuff in the chat, and I can't do both. I can't read chat and listen to people talk at the same time, so I apologize. But the chat is all recorded, will all be part of the recording, so we'll be able to look at it, and maybe we can respond after things are done.
We don't have any other hands raised at this moment. I know we're at the top of the hour, so anyone that needs to leave, thank you so much for being here. Maybe I'll just open the floor for one last final comment if anyone would like to offer that, and then we'll wrap things up. So one more chance if anyone sort of new has an additional comment. All right. And if not, then I think we wrapped up right on time. So let me get that last slide pulled up for you, Tom, so you can close
Sure.
out. But thank you everyone for being here.
All right, so as we begin the second year of our project, we'll start tackling our second deliverable, which is developing a set of research questions, high priority research questions that will be building off of the engagement principles. And as we go through those questions, we may have to come back to the principles and say, well, actually, as we're trying to put this all together, maybe this part of the principle needs to change. And so we'll be able to go back and make some more refinements if we need to. But our focus will really be on creating these questions. We have 2 more of these webinars on our agenda. So the next one will be in May 21st, and then October 15th. So they're about 6 months apart. After this, in a few days, we'll send out a survey to participants. So we appreciate if you can take a moment to give us a little bit more feedback and answer a few questions that we might have. We try to keep it to just the bare minimum questions that really we feel like we really want to know about. There are social media connections with Evermore. You can look those up and follow those. There's a lot going on besides this project. And the newsletter is a great way to keep up. There's the newsletter. There's also the science newsletter that comes out. I think it's once a month. So there's plenty of chances there. With that, I think we'll put up our thank you slide and say thank you. And really appreciate the engagement and the conversation that folks were able to have today, and the opportunity is to share all this with you. So thanks again.
Thank you.